Diabetes, everybody is like high sugar, high sugar, high sugar. The sugar is not the one we drink in our gari, it's not the sugar you drink in the cornflakes. And the glucose that we get is not being broken down from just the sugar we drink in our foods. Of course, our starchy foods. And then even our proteins.
I think in Nigeria also we do the test that we call the HbA1c test to identify if people are really having this diabetes.
Yeah, the HbA1c is a test whereby you do to see how much glucose the body has stored in the blood for over a period of 3 to 6 months. It doesn't lie, basically. It doesn't lie. It tells you how much sugar you have in your blood, and this helps people to determine if they, or your doctors or healthcare professionals, to determine if you are diabetic or you are
because
diabetic.
personally, being a female, I am a believer that women go to the hospital more, women do check up more.
Yeah, okay.
I'm not being biased, there's data of course outside, but I have used the clause that we may not have true representation of what diabetes mellitus in our society is all on about. Taiwo, don't get me wrong.
You said this about hypertension, same thing.
Because it is the fact. I mean, and this is why I'm so passionate about this. I am actually fighting for the men population in this case. I want more of our men to go out for checkup, preventive care.
Yeah,
by sponsoring research.
Because we advocate, we don't only advocate people to do the right preventive care, we also advocate, and then we admonish and beg the government to release funds, of course, for researchers who are really empathetic towards these diseases, and who are compassionate enough to want to do more scientific work on how to better improve people's lifestyle and know more about this disease condition and find solutions to them.
Hi everyone, welcome back to this episode on Vital Science Podcast. And my name remains the same, Oyinda, and with me here is Taiwo. On this week, we are going to be talking about diabetes mellitus. For everyone, diabetes. So, and a very quick one, if you have not seen our last 2 episodes on stroke and hypertension, I would urge you, both of us actually would urge you to go back and listen to them because they are very educative and they contain loads and loads of information that would benefit just not yourself, the viewer, and would benefit everyone in the family and then your acquaintances and loved ones too. So today we are going to be talking about the definition of diabetes, of course, the signs and symptoms, present data in Nigeria to compare how good we are on diabetes prevention, and of course control and treatment. And we'll talk about the impact on family, relatives, the patient or the victims themselves. And of course, we are going to be talking about the treatment modality, including emergency or urgent care. So, Tan, why don't you tell people about the definition of diabetes?
All right, thank you very much. That was a lovely intro. Diabetes, most people always hear, or like they say in Yoruba, onito sugar. But people don't really understand that diabetes got different types. And for us to be able to define diabetes, we've got to like define the types for people to know what they've got. And we've got type 1 diabetes, we've got type 2 diabetes, and we've got diabetes insipidus, which I'll be explaining as we go on with the podcast. So let's talk about diabetes, the type 1 diabetes, which is an autoimmune disease. But what is autoimmune? Autoimmune means the body is attacking itself.
Yeah.
So in the instance of diabetes, it's talking about when the body is attacking the cells that make insulin.
Yeah.
And insulin is needed in the body to produce to be able to like allow the cells in the body to absorb the glucose that we've eaten from the food after the food has digested it.
Yeah.
So when the body is attacking the cells that produce insulin, then there won't be enough insulin circulating in the body, and it's just be glucose. It's just like
the glucose don't have any insulin to attach themselves to. And then before you go on defining the type 2, just want everybody to know that diabetes, everybody is like high sugar, high sugar, high sugar. The sugar is not the one we drink in our gari. It's not the sugar you drink in the cornflakes. And the glucose that we get is not being broken down from just the sugar we drink in our foods. Of course, our starchy foods. And then even our proteins, all of them, we have glucose being broken down from even fats, all of them. So I think we'll talk about those things later on as we go on, and maybe we can define type 2 diabetes for people at home too.
So that's type 1. Just keep in mind and keep track. It's like comparison between the two from type 1 and type 2.
So now this is insulin dependent with type 1.
The type 2 insulin, it's account for 90 to 95% of diabetes you see in people. Most people that are older, like in their adult years, between when they are no longer adolescents and they're adults now, that's what you see in most people. So 90 to 95% of people mostly have type 2 diabetes. And it's when insulin resistant. The body is making a lot of insulin, but is unable to bind with the glucose in the body, whereby it's tricking the cells that produce insulin, tricking it into believing that there is no enough insulin in the blood flow. So all these things happen in the bloodstream. They all happen in the bloods that flow through your artery and vein. So when the body thinks that it's not producing enough insulin, it goes into an overdrive, which means it starts producing more insulin till, and when you like overwork something, it's like a generator now, water pumping machine that you on it from morning to night. It don't give you any rest. It's definitely going to break down, isn't it?
Of course, and this is not a generator that we can call brother Kazim from the area to come and repair. This thing is within the bloodstream. And that you made mention of something earlier about the type 2 diabetes being age factor, like something that starts after the adolescent year.
So one thing I'll make reference back to type 1 diabetes is these days, we'll come back to that really. We see more younger people with diabetes. I actually would be very real to say that most of this younger generation, children, they are diagnosed mostly with the type 1 diabetes. That is why we see them carrying cassettes. When we talk about the treatment, we'll talk about this kind of cassettes. They carry cassette around that gives them continuous insulin. And then for the type 2 now, being a female, I would know more. And this is because we have so many women who come down with gestational diabetes, that is pregnancy-induced diabetes. And then in most cases, it is expected for this thing to go away. Doctors would say, oh, madam, don't worry, we'll monitor you in pregnancy and it should go away. But then we notice that at the end of the day, I mean, after the whole pregnancy period, this diabetes progress into the type 2 diabetes. Now we see type 1 is like age factor. From our childhood, people develop like that into adulthood. And another tricky thing again is that the type 2 diabetes, again, as you've explained, could lead into the type 1. When the generator producing insulin firing, keep firing on, and at some point it stops producing, and now the body is dependent on the insulin to be produced, and there's none, as in the type of type 1. So again, type 2 could progress into type 1, and then type 1 could continue that way. Now I think there should be another type of diabetes here. We've talked about 3 of them, including that gestational. So now I would want Taiwo to also discuss the last one.
The last type that most people wouldn't even know they have is called the diabetes insipidus. And most people would think that it's got something to do with the blood sugar level, which is wrong. It's got nothing to do with the blood, the sugar level in the blood, compared to the other ones whereby they say it's got ito sugar or it's got a lot of sugar in his blood, like we've explained in type 1 and 2. And in this case, it's got issues to do with the kidney. The kidney is unable to retain water. And don't let me go into a lot of things but we know that the kidney, when people hear that they have kidney failure, whereby we'll still talk about kidney failure later on, but when they say they have kidney failure, the body is unable to produce urine or very little urine because the kidneys are
excreting what it should excrete to produce urine as an end result.
Definitely, yeah. And that's one of the function of the kidney, to be able to clean the blood of waste. Is like an excretory organ. That's one of the main functions of the kidney.
Yeah.
So when the body is unable to clean the blood effectively, it just allows everything to like pass through it. It's like a sieve to sieve away the waste and keep the good things. But in this case, it's unable to keep the good thing and the
But
right thing. We want to retain water, but not too much. The body is able to control to maintain homeostasis. That's balance. Homeostasis is balance to maintain balance in the body. But now the kidney is unable to perform that function, so it allows a lot of water. That's
to
why
be
you see
retained. Yeah.
a lot of people drinking water, they are urinating more, drinking water. This
Yeah.
this is different from dehydration or when you drink too much water.
Yeah.
This is different. You're like very thirsty, always going to toilet, even in the middle of the night. You have to wake up, urinate, and there's a lot of symptoms. We'll get signs and symptoms. We'll get to in much later in the show, but we just wanted to like give you brief definition to go about what type 1 is, what type 2 is, and what diabetes
Diabetes
insipidus
insipidus is
is,
all
so as
about.
not to mix it together. So you'll be able to like track with us as we talk about it as we go forward.
I think maybe this is the right time to also inform people about the diabetes ketoacidosis.
Yes.
And could be a complication of either one or two. And this happened when diabetes has been left untreated for a very long period. And then people start getting all these autoimmune comorbidities of systems being affected. Initially, the kidney or the liver might not have been affected. When ketoacidosis, from the word acid, so something's acidic. So ketoacidosis is when there's like toxicity caused as a result of this glucagon, the glucose. It's like too much of them, and then it's causing toxicity within the body. So people with this, they tend to come down with symptoms like, I'm sorry to say, for people who are suffering from this, like some foul smell, like fruity. It will be fruity. People will be like, oh, I mean, you smell fruity, or when they talk, you talk fruity. So whoever has not had any symptom or has not suffered any injury in the past, is being perceived of having this fruity smell, I would advise, for the sake of this educative program, to go ahead and check their blood sugar today.
We are doing the introductory part.
Yeah.
We talk about the scientific findings, like the percentage of people in
Absolutely.
the percentage of people with diabetes living in Nigeria, and most people don't even know they have this.
So thank you so much for that, Taiwo. The beautiful thing is there are enough data actually, data from as far back as the last 10-15 years, which I think are still very recent according to the WHO. Because there is always this prevalence or the surveillance report for the next 10 years. So, but one factor stands. While we are going to talk about all this data, it says that the statistics of this data may not be the true definition or depiction of what Nigeria Diabetes Mellitus Society is all about, as a result of research being carried out in some particular part of the country, like some geographical region, whereas there is no data to compare from the other part of the countries. And then there are some data that are conducted mainly within the urban setting, whereas the rural environment, there is nothing to compare data on. But for the sake of this argument, to expose us to what is currently happening. So the thing is, there are data conducted within the urban setting of the Southwest. We have some metadata to be compared as far back as 2013, 2016, 2018, and you'll be surprised that up to 43% of people as of 2021 are unaware of the fact that they have diabetes.
Yeah, that's
Very
similar.
shocking. I mean, it is the computer age. So, I mean, we believe that there's so much enlightenment, there's so much thin information going on social media, but yet people do not know that they have this thing. And then, I mean, recently also my mom, she was talking about what test she could do. And I told her that she needed to go into the hospital to do the blood sugar monitoring. You would be surprised that many people, I mean, she was telling me that most of our friends did not know that it is so cheap to go through, to do the blood sugar test. very, very cheap, easily accessible. And then as of 2013, 2018, the data says that 0 to 43% of people were suffering. And then a total population of 90,000 plus people presented at one university college hospital in the southwest, presented with undiagnosed or to be treated already diagnosed case of diabetes mellitus, and then 43% of them were scheduled aside and were freshly diagnosed. Of these people, we are not talking about male or female in this case, because the data, there is no specificity of data to tell us accurately if men or women are more affected. But I would say that because personally, being a female, I am a believer that women go to the hospital more. Women do check up more.
Yeah, well, correct.
I'm not being biased. There's data, of course, outside, but I have used the clause that we may not have true representation of what diabetes mellitus in our society is all on about. Taiwo, don't get me
You
wrong.
said this about hypertension, same thing.
Because it is the fact. I mean, and this is why I'm so passionate about this. I am actually fighting for the men population in this case. I want more of our men to go out for checkup. Preventive care, in my case, actually, I'm directing it to everyone, but my main focus is more on the men. And then back to the data now. And then they said of this 43% people population who have just been newly diagnosed of the diabetes mellitus, I think 33 to 39% of them are adult, whereas the other ones are children. So this is to say that people may think that children are still not, they can't have diabetes. And this is why I think the population of children or the teenagers or the adolescent being diagnosed with diabetes is really low, is because there's this myth or misconception that children cannot have diabetes, which is wrong. Because in the Western world, if you have to compare data to the Western world, where about more than 21% of children are being diagnosed with type 1 diabetes, type 2 diabetes. So it would be shocking to see in our society, we use a lot of starchy food for our cooking. So we are trying these days to balance our diet, but we may be surprised that if the end product of our food, when broken down, would contain more glucagon, and we are feeding this to our children, to the elderly ones, what stops us from having these autoimmune diseases too? African is blessed. We are blessed. We know that with our food and everything, but autoimmune disease could affect everyone. It's just like cerebral palsy or any maternal or maternal birth defect. So I think we'll go back to that in later episodes. If you want to tell us more about also some of the data you know about.
Yeah, sorry, I was trying to say previously that these, according to the International Diabetes Federation, they said about 3.8 million Nigerians currently, that's our 2021, live with diabetes. And you said it's not an adequate representation because a lot of people go undiagnosed, or most of the cases go unreported in hospitals because of limited access to public health. And you see a lot of people that attend these, not to attack anybody, these local herb sellers, whereby they buy different herbs to cure their diabetes, and it affects their health and become complicated. And when you said a lot of people present at the later stage when it's already complicated and there's a lot of systems that is already affected and their blood sugar is out of control, you could not even believe what this reading is. So then another paper I saw, or article I saw, a scientific article in the journal I saw, was similar to yours. About 30 to 40% of people don't even know they got diabetes.
We will talk about the complications of diabetes, but most people, when they hear diabetes, they think, oh, they are going to cut off his legs or cut off his hands or hands. But one thing is, from the data that we are still talking about, we will be surprised that of the 90,000 something population in one specific tertiary institution of hospital where they conducted a research, of the 43% that were newly diagnosed and then the rest. So eventually, more than 60% of them developed the complications and they needed one or two or maybe all of their limbs to be cut off. Now imagine that 60% of people come down with complications and they needed
either one or two or all of their limbs to be cut off. I think we'll talk about that in later segment. Now I think we should talk about the signs and symptoms here.
Yeah, I'm sure that's what most people want to hear, and
Yes.
to be able to like look out for these if
Because
they
I
notice.
think we've been speaking too much English this morning. So let's talk about the signs and symptoms.
Yeah. So the signs and symptoms most people see when they suspect, or they might not even know they've got diabetes.
Yeah.
Let's talk about. I think we should talk about it with different the types of diabetes, so we can go with the flow. The first one I think most people see with the type 1 diabetes is
Excessive hunger?
yes, that's what I'm trying to say.
Yeah,
They feel like they need to eat more and they keep eating more.
Yes.
Because the insulin in the body is not attaching itself to the glucose, which whereby the cells in the body can use the glucose for energy. And before we continue, I'd like to talk about what the cell does and how the cells attach itself to the glucose,
Yeah.
so as to be able to use it for energy. And as we know, the cell is the basic unit of a living being.
Yeah.
Everybody has cells. We've got like billions of cells in us as a human being. One human has got billions of cells, and each cell, they need energy to function. Each cell has its own function. So whereby in the bloodstream, for each cell to be able to get their energy, insulin needs to attach to glucose. And once it's attached to glucose, then the cell opens up and absorb the
Glucose.
the glucose that is already bounded to the insulin and use it as for energy. Whereby in the case of type 1 diabetes, this person, the insulin is not able to bind the glucose, because the body is attacking the cells that is producing the insulin.
Yeah.
So there's limited production or no production at all in the body.
Yeah.
So the glucose is just free flowing, like in the bloodstream, just walking around.
Okay, right.
So, and the brain is going to tell the body is telling the brain that we are hungry. The cells are telling the brain that we are hungry, give us food.
Yeah.
So the excessive hunger, and
It's just like if a generator is working and then you open the pipe somewhere. Of course, the fuel is leaking somewhere.
Yes.
It's not being used. It's not being consumed as it should.
Yeah.
So basically, excessive hunger, and then also from defining diabetes for us earlier, when you talked about people going to pee a lot. I mean, people could liken this to being pregnant. That's for women. I mean, men cannot be, urinating excessively and you think they are pregnant. But another thing is for people who may be taking alcohol, which we'll discuss in the risk factor here. So they may tend to pee a lot as a side effect. So now it's become dicey for people who take alcohol, and we may have diabetes. How would you know? But the thing is always knowing oneself. If you know yourself, you know, even if you take alcohol, you know the amount of time you go to pee. So how would you know now when the urination has become like multiple?
Yeah.
And increased.
Another case is like because there's so much glucose in the body, the kidneys are trying to eliminate or excrete. Yeah. So you urinate more, and you notice like some people, when you urinate, you see that their ants getting attracted to your urine.
Yeah. So another thing is in the case of diabetes, do people increase weight or they lose weight?
Oh yeah, they definitely lose weight.
Exactly.
Because your body is not getting the right glucose. Thank you for reminding me. The body is not trying to. The body is not getting enough glucose, and the body is hungry, telling the body is hungry, and there are some fats that is already stored in the body, whereby the body burns through the fat. That's when you see like someone is losing weight. Not planned though.
It is not every case where you see people losing weight. You say, he has contracted HIV or STD. No, it's not every case. People should, tailor down into what is causing person to lose weight. That is why hospital is the first place for people to always go to. Do not be afraid. Hospital first. And then I think another sign is that there's so many signs and symptoms.
So many. So, like what's the name? The weight, like you were saying, is unplanned. So it's not like someone is planning to be fit, and because they are looking more fit, or you're not saying, this person has diabetes because they look leaner. Meanwhile, it's not true. The person planned to like lose weight.
Another thing is with diabetes, we may say that they are not getting enough sugar or they are,
Yeah.
so when people have eaten too much or they have eaten less, there would always be a sign. This is why there's signs to every disease. So they've eaten too much, they are peeing too much, they are feeling too disoriented. In some extreme cases, when the sugars are the glucose within the bloodstream are too high, disorientation or confusion might even set in. In another case where they are not eating too much and there is nothing to convert or for the insulin to bind to convert to glucagon, they become excessively hungry and they start to feel lightheaded or dizzy. So those are the things. So continuous feeling of lightheadedness, and you've not been diagnosed of any anemia or loss of blood, and you cannot know these things from looking at people. People that look at others and they say, oh, you are white, you are pregnant, or you are white, you lost, you are anemic. Hospital is always the best place to go to.
Definitely.
And then again, another thing I would say in regards to wound is that people get wound. They heal.
Yeah.
1-2 days, they've used their normal chemist shop, they heal. People don't go pharmacy or they've been to a pharmacist, well-read pharmacist to look at their wound. It's not healing. The next thing people should be thinking about, nobody should tell you, even the pharmacist, no one tell you because of money. The first thing, people should know in this case, we are educating, I don't want to blame anyone, is that could it be something else? And that something else may be as big as diabetes. Because diabetes is actually what disease do they call our jejere in Yoruba?
Cancer.
Yeah, exactly. I would liken diabetes to that, to cancer, when it is not being catch young. Diabetes is a disease you catch young. When it's not caught young, it's very, very deadly.
Okay.
And then so people have sustained wound that should heal in 1 minute, 1 day, 2 days. It's not healing. They've taken their tetanus injection to prevent infection setting in.
You are saying
Still not
people that most people take that tetanus injection.
Well,
how many people take?
Okay, this is another. This is why we are educators and advocates. This is another area where I tell people that whenever you sustain injury, your tetanus injection, have you taken within the last 3-6 months? If you have not, it is very, very important. Don't be using knife.
Do you know what it costs?
Well, I don't want to be insensitive because we are talking about finance.
Yeah.
Talking about finance.
Do you know how much it costs?
We are talking about finance, but health is wealth.
Definitely.
Health is wealth. And when we put our mind to something, even to the poorest of the poorest, when we put our mind to something that benefits us, we'll get it done. So, now to the people who may not be financially buoyant to get the tetanus injection, I am not very certain. Maybe people at home can educate us. Because I think some primary health care center used to be part of their preventive care or emergency care that they give in the past. As of 2018, I still believe they were doing that, but I'm not very currently sure of the data because there's nothing to look at. So if people can educate us, if primary health care centers are still doing this, and we can advise people to go to the nearest primary health care center in their area, or maybe the pharmacist too.
I think the way the healthcare centers in a lot of places in Nigeria, they actually give tetanus injection for free.
Exactly.
But you have to pay for the consumables like the syringe, the needle, and cotton wool and all that stuff.
And I do think in the rural areas, now for people who are in the rural areas, I think still happening, this is 2025, but still happening. People could exchange what they have for the consumables. Oh, I have yam, I could give yam to these people. Or I could sell my yam for them to give me the consumables that is needed. But not to derail too much. Let's go back into the signs and symptoms of the diabetes that we're talking about. But please, people, take your tetanus injection. So we've talked about the weight parts, the excessive thirst, hunger, and urination. And now, in extreme case, earlier on we discussed what is the ketoacidosis. Of course, the fruity smell will be there. The wound will also be smelling fruity.
Yeah.
And then I am so sorry to say that wound may become, the cells within the wound may become deadened as quickly as the wound happened. And then maybe in extreme case, maybe this is a complication of it. It's where people develop peripheral artery disease. So whereby there is no enough blood circulation to the part of the body where the wound is sustained.
and then the wound is not healing. That is basically why the wound is not healing. That is why people eventually have to like cut the leg. So now, remember earlier we were talking about alcohol, or people that take alcohol. Not that I'm advising anyone to take alcohol, or I'm telling people to stop. I can only give people reasons to not take.
I mean, you could tell them though. You could tell them to stop taking alcohol.
Well, this is
It's not good for the body.
Okay, I mean, listen to Taiwo.
I'm not attacking anybody, but it's not good for the body.
I mean, he's saying the truth, but I mean, not to attack, just not to attack him.
I mean, I'm actually attacking people.
One thing for you to take away from these signs and symptoms of diabetes is like, if you notice the trend, there's a lot of things happening. You overeat, you over urinate. Even at night, you wake up to urinate,
And yet the weight is not increasing.
yes, the weight is not increasing. So these are the things you should take away. All the negative parts are like a lot. The good thing are like reduced. So the person does not have a lot of energy, losing weight, and they like that. So that's what you should take away.
And then they look at some people. I mean, like, you see Auntie Reese, she can eat it. She can eat the 20 bowls of rice, and yet she's still like this. I mean, actually, I don't eat too much. I'm also like that. I'm also like Auntie Reese has described. I don't eat too much. So and I don't pee a lot, and I don't drink too much. In my own case, I could say my weight is not liking to that. And I'm not also generalizing. This is not a generalization to everyone who have the habit of eating a lot, drinking a lot, peeing a lot, and still their weight is like that. But as an advocate that we are,
Yeah.
I think we would advise such a person to visit the hospital, even if they've never sustained any wound that's refused to heal. So it is like a progression of type 2 diabetes being there for a very long time. It will progress eventually to ketoacidosis in a case where it becomes, boom, there's no solution anymore. So now,
The diabetes insipidus, we didn't talk about
the
that
signs
one.
and symptoms, yeah.
Is similar, is a little bit similar to the signs and symptoms of the type 1 and type 2 diabetes. But in this case, it's got nothing to do with your blood sugar, your blood sugar level. Mostly is the kidney. You need to like treat that's why we say
The underlying factor.
attend to the hospital. Stop going to your local chemist. They are only licensed to sell certain drugs, even though I know
They're
some of
selling
them
more
sell
than-
what they should not sell.
Yeah.
But just to preserve yourself and save your own life, you should go to the hospital. You might, how do they say this now? A stitch in time saves nine.
So instead of you wasting your money paying a chemist to give you a drug that you don't need, that might cause a lot of other complications in your life, just gather that money together. You don't even need to gather the money together. You could attend a public health center whereby you could pay them to just do your sugar test to like know if you've got diabetes or not, or explain your symptoms. I'm sure there are health professionals there whereby they know when to escalate to let you know that, oh, you need to go to a state hospital. We don't manage this here, or if they can manage it, they will let you know.
Yes.
You're going to talk about the risk factors.
Oh yes. Thank you. I remember earlier on when we were talking about people who take alcohol.
Yeah.
And then I said, I mean, you've admonished them not to take. So, I mean, one of the risk factors of diabetes, of course, is obesity. I mean, and this is not being fat phobic. I'm not fat shaming anyone, but there's high tendency that people with large adipose tissue, fat within their bloodstream, that they are prone to getting their glucagon detached from the insulin, and then too much of glucose in the sugar, like if explained earlier in the type 2, could lead into the type 2 diabetes. So this is why, I mean, there's sensitization for everyone. People will go to the gym. Well, people go for fashion. They go there to look good. But let's look on the bright side. There's more benefit than the myth or the, I mean, hard look that we give the gym. If you go to the gym and you are doing the exercise, even if you do 30 minutes of exercise and 1 hour of picture, I would rate you, honestly. So people go to the gym, and then one thing again is people need to be active. Market women, people in the offices. How are you diluting your sedentary lifestyle with activities? When you sit for 2 hours, do you manage to walk for another 30 minutes? Women in the market, I think honestly, people in the market, they talk more than they walk. like normal walking, and they talk more than they do activities. So which can be actually extremely tiring too. But then I would advise people that they inculcate the habit of joining walking or working with the sedentary lifestyle. Because when we talk about hypertension, I would refer people back to what we discussed about stress. When you are stressed, you need to rest. But in this case, when you rest, you need to stress yourself again. So, and another symptom risk factor I'll talk about is consumption of alcohol. Consumption of alcohol, because there's a lot of data and report and scientific report outside there that has linked alcohol consumption to a varied number of diseases: liver, kidney, heart.
See, I'm
Many
vindicated.
things.
I am vindicated. I am attacking you people. I'm begging you.
So
stop taking alcohol.
Actually, it sounds like Taiwo is trying to chastise people, but he's actually doing the good, because people need to know the bad thing in taking alcohol. Honestly, for some people who have been trying to stop, I mean, I wish you the grace to be able to stop. And then for people who do not want to stop, maybe this would admonish you to stop. Actually, also, there have been scientific papers, researches that have actually identified that even smoking and recreational drugs could lead to this diabetes.
Yeah.
And then another thing we have to talk about is genetics.
Yeah.
Genetics. And then it is said that if any member of the family, and then it says most especially the male generation, has had diabetes, there's high chance of the offspring getting diabetes.
They'll go with it.
And then, of course, there's the mutation.
Gender-based argument again. Everything is.
And there's the mutation of the gene, because in gestational diabetes, there's high chance of the mother, when she has diabetes during pregnancy, there's high chance for the child to also be born with diabetes due to genetics and mutation of gene. And then again, of course, we talk.
Wait, before you go on, something just came to my mind.
Yeah.
There are some babies that when the mother has diabetes, when they give birth to them, that people will be like, your baby is big, not knowing that they are microsomal babies, that they are babies due to the mother having uncontrolled diabetes when she was pregnant. Then the baby is really big, and people will be like, I want a baby like that. But that baby is unhealthy. And trust me, you don't want a baby like that. I'm at the laughing now.
Babies can be big, but there's standardized, accepted birth.
Yes.
I mean, weight
Size,
for every
yeah.
babies. So
Yeah.
I mean, we're not being fast-phobic for babies, no one at all. And then to move forward, I think we've talked about the weight thing and then the mutation. So now we will talk about the idiopathic risk factor. And then remember when we talked about the type 1 diabetes, we defined that as the one where there's autoimmune reaction going on, where there's the body itself destroying some cells and causing insulin to be destroyed. And then we would see that even though science has tried a lot to see what is causing this thing, in every diseases that are caused by autoimmune, we just don't know why the body rejects or destroys some cells. It's just like when something grows where it is not needed and then it is rejected. So in the case of autoimmune, nobody can explain. It's just idiopathic, nobody can. I think there are some researches going on. I think there is one happening in Japan where they are doing research on what could be causing the chromosomal damage that could be causing this type 1 diabetes. And another one on Down syndrome. I think would look onto the Western worlds when they find something for us. I hope we would be able to benefit ourselves in this part of the world. And then again,
we can also do better. The government can do better. By sponsoring research.
Because we don't only advocate people to do the right preventive care. We also advocate, and then we admonish and beg the government to release funds, of course, for researchers who are really empathetic towards these diseases, and who are compassionate enough to want to do more scientific work on how to better improve people's lifestyle and then and then we want to, know more about this disease condition and find solutions to them. We can also find solutions here if we have the right funding and right equipment.
Why not?
There's nothing stopping
Africa. They don't sponsor enough research. That's what I've grown to understand. They don't sponsor enough research.
I have a friend who says he's interested in going into research, but then there's no enough funding. And another problem he has is that you have to know some people before you can get an access. I'm not going to say that there's nepotism everywhere within the work sectors of Nigeria, but seems like people talk about it underneath, but there's no scientific factor, so I can't base my judgment on that.
And another thing I've noticed is like the record keeping is not really that good. Like some countries like the UK, whereby if you need a data about a disease condition, you could go and ask for the data, and they will provide you the data. Compared to Nigeria, when you want to do research, some people will be asking you to bring money, like you were saying, which is a tale as old as time. We don't want to dwell on that. And even the data are outdated. Before we started the podcast, we're having a discussion and all. Like some of these data, like they are outdated or they are falsified. When people have been frustrated, if I want to do a research, you are frustrating me when I want to do a research.
I have no other choice than for me to conclude into what I think would be accepted.
It's not a good thing. Don't falsify data. We're just saying like those are the problems that is faced by researchers in Nigeria, and we hope the government will be able to think about this and have maybe a stakeholders meeting on how best to improve this and to help the country as a whole. We saw during COVID, when the UK came up, the university in the UK, the researchers came up with the COVID vaccine.
Oh yeah.
And you saw they did it in a really fast time. So we also could do something like this. There's a lot of fun is going into research. Some diseases that affect us, like sickle cell, that affect a lot of Black people.
Yeah. Which is now being eradicated even in the Asia.
Exactly. So if you put a lot of fundings to these diseases that affect us as Black people,
because we're educated, we have the right people, we have the right minds to make these things work. Many of our people are in this part of the world carrying out this milestone, groundbreaking findings. Yeah. But then if there's no support in our own countries, as Africans, of course they have no other choice than for them to go to where they could have the avenue and then the right resources and support to do these things. So we can't really blame the healthcare providers or caregivers in this case.
You've talked about some of them when you were talking about the risk factors, like people that live sedentary lifestyle, you live an active lifestyle whereby you make intentional decision to be physically active. Maybe you do a job that you sit down for 6-8 hours, and in between the jobs you can stand up and stretch your leg, walk the stairs. Maybe you have a lift in your office, you take the stairs rather than using the lift. That I'm sure you'll be able to 5 minutes, 10 minutes of exercise. And when you get home, maybe you take the public transport rather than you taking the public transport to your house, or if you have a car, instead of you driving to the filling to maybe a store to buy some groceries, why not just walk to the store? 15, 20, 30 minutes walk every day.
Walking. You don't have to go to the gym and run on a treadmill. That is too expensive, and with that current financial situation in Nigeria, walking.
It's freely given, isn't it?
Exactly. And this is not to diss anyone who is not able to walk. And then I believe people who don't have the opportunity to walk, to do these exercises, who may be at some kind of disadvantage. Wow. Maybe there's some exercises online that can be accessed. But in a case where they are not able to access and they can see us on this video, I would recommend us taking maybe that heavy pot in the house, or that heavy chair, or that heavy bag that you could hold and then lift with your hands. Do that. That is enough exercise. If you do 50 of that today, or 25, or even if you're able to do 5 today and tomorrow you are able to do 10, and then the next tomorrow 50. So it's actually exercising. It doesn't have to be running, it doesn't have to be walking. It's just do something that physically challenge the muscles
Yeah.
So, and then we know that if the other part of the body that is affected is not exercised, I mean, that is not anybody's like your fault. But then you are able to exercise what should be exercised. Well, I always like to talk about diet.
Diet, food, very important.
Food. Now, you have not been diagnosed of diabetes. You've been eating everything you want to eat.
Yeah.
You've been seeing all these common symptoms.
Yes.
This is why we didn't go into the excruciating scientific symptoms. It's like loads and loads of them, 20s of symptoms. But we tell people the ones that they can easily find amongst these people in this amongst the populace. So now you've been diagnosed, or you have not been diagnosed. You've been eating everything you can, but all of a sudden you start to feel symptoms of, I pee a lot, I'm excessively at night, I'm too thirsty, I'm losing weight. This is the time, even before you go to the hospital, for you to think, how can I combine my food in the right proportion? And again, Nigerian socio-economic factor is not allowing a lot of people to eat right. But I mean, if you are able to even cook vegetable, from the spinach from the market, water leaf from the market, you eat that today. If there is no other protein, that's enough. But just to make sure that there's like balance of food being eaten.
Not bread every day.
And another thing is, some people would eat eba and egusi. I mean, I would actually want to, apart from fat and minerals in egusi, and then of course the water in it, and some, because of the protein added, some protein in it, and the carbohydrate from the processed nut. So I'm trying to imagine what again people could benefit from egusi, actually, because I have seen examples of people who only eat eba and egusi without nothing else.
Nothing else like the protein.
But just like, I mean, I just want to use this. I'm not using this set of people that I want to mention as a case study. But people will go to like Baggy Market to work, and then there is one Mama Chidima on the side who cooks very delicious eba and then egusi soup, and that is what they eat every afternoon. Then before they leave the house, they are eating rice, just rice, plenty, or maybe whatever they can do with just rice, and then the shrimps, or what is it periwinkle shrimps, or what do people eat? Is it prawn? I don't know. I'm not even sure what people eat these days from the market, because it's so difficult to get something affordable. So now you've eaten what you could without enough protein, which was starch. Afternoon again, you get to the shop at Gagi, or you get to maybe Yaba Market, and you went ahead again to buy your semo or the eba together with the egusi soup. What do you want to eat at night? I mean, this is the right time when we tell people to balance their food. At night, you shouldn't even be thinking of eating another gari again. I mean, this is what is available for people. But truthfully, gari is as expensive as many food right now in Nigeria.
But most of our foods, are present for us, readily available.
Yeah.
They are high in starch.
Yeah.
And I understand from your point of view of people eating that,
Right, yes.
but we are not saying people should not eat starchy food. All we are saying is like everything has to be in
The right
moderation.
proportion. And that is before they are diagnosed with diabetes.
Yes.
So once they get diagnosed with diabetes, anything that contains too much carbohydrate needs to be cut down.
Yeah, and there's a part that
Quickly,
people
this
don't
comes down.
people don't understand. There's a stage in diabetes called pre-diabetes stage,
Yeah.
whereby diabetes can be reversed.
Reversed.
You with diet, physical activity.
I mean, I've seen a lot of Hollywood, or what are they called, celebrities. That's a few of them. Let's not elevate or inflate the number. That said they reverse type 2 diabetes. Really, could be right, but I would say professionally that it could most likely have been the case of pre-diabetes state, because the pre-diabetes state most times would mimic the type 2 diabetes, and people will confuse both, especially if they don't have the defined diagnosis, and people say, I beat it. But miracles happen when it is pre-diabetes. Type 2 diabetes, I am a believer. I'm not against miracle, and I believe in miracles
happen in type 2 diabetes.
Oh yeah.
But you have to be sensible though. I think that's where
you have to have done all the right things.
Yes.
You have to have done the exercises, you have to have done the meals.
Definitely.
You have to have, if your doctor prescribes you medication, because Another thing is there's this myth with diabetes and hypertension. People think once they start using the medications, they can't stop again in life. When people have been really like vigorously doing the right thing, I think a time would come when they will be like, it's like a trial period of medication, and the medication is removed to see how the person does just with the exercise and the meal or dietary like dietary regimen or regulation. And few people have been found that they revert back to the normal state of health. This is because it is not just the medicine, you are doing other things right.
Definitely.
So now, if a doctor is telling you to use medication, I mean, try as much as possible to be compliant. It could just be there's something we call it the trial period, where the doctors would give you one medication first. Another thing with our fathers, oh my goodness, I remember. They give you one medication and you go back again to check the blood sugar. Oh my goodness, it's still high. I need another medication. Your doctors, they know what they are doing. They know what they are doing. Maybe in most cases we may think they don't know. And this is where sometimes we, the healthcare professionals, will tell you to get 2 or 3 opinions from other people.
Yes.
But in a case where your diagnosis is already established and then you are being treated by somebody, now it's moved on from preventive medicine to curative. So you should actually walk hands in hands with your doctor. If you should ask them questions too.
You have rights.
You have the right to ask people questions. If they give you a medication, just one of them, and you've used it for a few weeks, and then you are not seeing changes, ask your doctor, how many weeks do you want me to use this for? Is this a trial medicine? Should we be combining something else? So your doctor will give you more than 2, up to 3. It depends on what your blood sugar reading is given.
Yeah.
Taiwo, I think we have not given people the right blood sugar reading.
Oh yeah. Would be putting the reading for easy reference for people.
Yeah.
In Nigeria, I believe we use the milligram per deciliter.
Yeah.
In some other countries, they use millimole per liter.
Yeah.
So we'll be putting the ranges for the milligram per deciliter and the millimole per liter. We'll be putting them in the comments.
And this is where we would know whether people are truly watching, and reading where because this is not just watching us, this is also reading what is being posted. So for emergency care now, we've seen people going into like maybe diabetes coma.
Yeah.
So what can we do at home? Or we see some people like, oh, he's fainting. Maybe due to hypoglycemia, that is low blood sugar in this case.
Yeah.
And we've seen cases where people treat hypoglycemia, that is a low blood sugar, a lot. So if you've treated hypoglycemia consecutively in a month, like 2, 3, 4 times, which has not been happening before, it is a time for you to go to a blood sugar test.
Yeah.
Because for every sugar that is high, when you are not eating enough, you are not meeting that target, would always be low.
Yeah.
And this is a point where it needs to be there. I think in Nigeria also we do the test that we call the HbA1c test to identify if people are really having this diabetes.
Yeah, the HbA1c is a test whereby you do to see how much glucose the body has stored in the blood for over a period of 3 to 6 months.
Yeah.
It doesn't lie, basically. It doesn't lie. It tells you how much sugar you have in your blood. And this helps people to determine or your doctors or healthcare professionals to determine if you are diabetic or you are pre-diabetic. When you are pre-diabetic, that's when it's easily reversible with diet and all. While if you enter into full-blown diabetes, when you notice you've entered into full-blown diabetes, that's when you use your diet and exercise to manage your symptoms together with your medication to help improve your health. So that's the HbA1c test.
But that is not the one the chemist will do for you. No. The chemist can only check your blood sugar level.
Yeah.
Which, if I'm right in millimole, there's a range of for people who are not diabetic, there's a range of 5 to 11 or 7 to 11. And then
it depends though. It depends on if you've eaten or if you've not eaten. So that's when you go to hospital and they'll be like, imagine, wow, don't eat before you come for this test, or don't even brush your teeth, because it's been found that some toothpaste they contain
like
glucose. So when you drink it, when you swallow the toothpaste, you are eating a little bit. So that can like spike your sugar level. So that's why they say you could do it at home or come to the hospital. Don't brush, just come that way, and we'll do that for you. And there's a lot of tests that you could do. Yeah. We were talking about the management before going to prevention. We're talking about management of someone with hypoglycemia, which means low blood sugar, and the management of someone with hyperglycemia, which means the blood sugar is really high.
So now people with, of course, the low blood sugar, you see people that this person is fainting, like I said earlier, and then they rush and give them Coke. That is what we give mostly in our society, Coke, which is actually very brilliant. So, and now for the hyperglycemia, I don't think there is any emergency care that can be given by anyone. It needs every medication to treat hyperglycemia. Hyperglycemia is a case whereby there's high blood sugar, and that can only be as a result of diabetes. So it can be treated by your chemist. It can be treated
by Coke. Or pouring water on the person's face.
Definitely not. And it cannot be treated by you going into the toilet so many times to put away the food that you don't already chop. It cannot happen. You just have to take medication or do something, which can only be done by your doctors or the nurses. So even if you go to the nurses and they do your test, you still need medication prescribed by a doctor, which is always why we all on seeing a doctor. So now for the management, I think from everything that we've talked about, people should be able to identify the immediate case of diabetes. They should be able to identify do what is best, which is by visiting the nearest maybe health center or a nurse or the hospital or somebody with the glucometer. Glucometer is the machine we use in checking blood sugar anyways.
When we say nurse, we don't mean auxiliary. Don't go to quack and shut in your life.
They're not nurses.
Don't shut in your life. I know
quack is what they are. They are quack.
I know most people like call them, oh, I know this nurse. No, she went to school in that hospital. And this is it's ridiculous, man. It's ridiculous. You are killing people.
I mean, it gets to a point where I say people are killing themselves because even though people know they are not nurses,
they are going to them. Do they know better?
Some people know, yet they are going to them. So it's not killing people this time around, it's people killing themselves.
Or maybe it's the two. Or maybe it's the two.
Maybe both. We would agree.
It's usually cheap, and when you give them probably 5K, they will buy normal saline for you and buy some artemether and treating you.
And they flush the system.
And they'll tell you they flush the system.
Oh my goodness, I forgot to talk about that. In the management, flushing the system is not right. Nobody will flush diabetes out of your system. Thank you for reminding me of that. Nobody is going to flush diabetes out of your system with sodium chloride and that yellow thing, the vitamin B code. Nobody will flush diabetes out of your system.
Ignorance. Most of it boils down on ignorance. People don't know their rights.
I mean, we are not laughing at people. I mean, it's painful.
Yeah, I mean, if something is past crying, you laugh, isn't it?
Yeah.
So, yeah, I feel like most people and a lot of doctors, nurses, that you have to train these people. I'm sure maybe you don't get caught, but I'm sure if you believe in an higher power or something, or if you believe in karma, it's going to catch up with you. These people you are training will be the one ending up to treating your old age, and they might do something really bad for you. There's a lot of people that have lost their lives.
To digress a little bit, Taiwo, I saw a video on Instagram recently of a nurse, the quack, doing graduation, or is it induction? They call it induction.
Is it induction today, or they call it freedom?
In that video, they said she was doing induction or graduation. I don't remember what particular word they used, but we all know she was doing freedom. And then the family members came outside and they were like, spraying this money. Oh. I'm like, if you have this amount of money, why not just send this person to school?
That video, was it the same one that she was taking blood and she injected the blood back into the brain? I screamed. I was like, rah! What's this? And she didn't even. Did she wear gloves?
She did not.
She didn't wear gloves. And the person allowed her to inject her. I didn't even think the words them was sterile enough, the syringe and needle.
We don't know where she got the syringe from.
Then she took blood from the person
and then injected it back.
I was like, oh my God, God have mercy. These are the things we are saying. This is promoted in in the country. Like, oh,
And,
if you can't get to uni,
whoever is going to do your blood sugar test, I don't think they will be taking blood from that place.
No.
The finger test is just what everybody do now. Because if you are going to visit one auntie nurse, I mean, quack is what they are. If you are going to visit them and they are telling you, oh, madam or uncle or daddy, we have to tie something around your hand and take blood for the blood sugar test. Quack.
maybe the HB1AC test, maybe.
The quacks do HbA1c. Let's be real. Let's be real. I mean, you also mentioned something about relation of diabetes to kidney earlier.
Oh yeah.
So if you are going to visit a doctor, have it in mind that even though we say a quack will not do your blood test from there, doctor will recommend that.
Yeah.
Because they would want to have a look on your kidney function.
Your heart.
Of course, and they want to see
organs.
your full blood count to see that your fainting or your lightheadedness is not anemia. So that will not give you wrong diagnosis and be treating lakpa for a stroke.
That's why we're saying don't visit quacks. Because they don't know the difference. They don't know the difference why you're doing this. They just learn the work. They did not learn.
There's no clinical inclination as to everything they do. So they go to school to learn how to choke injection to a vein and return blood back. Not why it shouldn't be done. So let's not kill ourselves. Nigeria alone is killing us already. Let us not kill ourselves by, the practice of all this quackery.
You know, I saw another video of someone finishing from, is it what do they call these schools? Health technology schools?
Oh.
And he was calling himself a doctor. I was like, what is happening, man? He looks at the back, his name is Doctor. I was like, what are these people doing?
In Nigeria, quackery, auxiliaries are not the only ones practicing quackery. That's another thing for another day.
A doctor,
and
man.
I think we are going to be nailed for this thing. But I mean, truth must be said. Truth must be said. Because there are CHOs and CHUs that you will find in healthcare center. And another thing we have to tell people who will be going to healthcare centers to do their blood sugar test is that most people you find there are mostly CHUs, and then CHOs. Then they are not nurses, they are cadres, below the nurses. But they are licensed to do this test. But portraying themselves as nurses and doing something higher that they shouldn't be doing is where you cut it off. And that is where we recommend you asking for a doctor.
Yeah.
Because now it's the porosity within the healthcare care system of Nigeria is so much that even the healthcare providers, we are also overwhelmed.
Yeah.
So
you actually have a right to ask the person treating you what their qualification is.
That is if they don't take it personally.
But I feel like you have a right to ask, are you a doctor? Are you a nurse? Where did you go to school? It's dangerous.
While I was in school, in nursing school, I have seen, quote unquote, some CHOs that they got by a patient, visited on that day. I had a placement, community placement. Asked them if they were they call them matron. Every one of them is matron because they believe all of them are nurses. Like, maybe that person is enlightened. Maybe they have a family member who has enlightened them, or they've seen similar video to this we are currently doing and they know better. And the person, the CHO got really annoyed, like, will you be teaching me my job in Yoruba? So our combination, people take it personally. And another thing is, you as a young person, you go to them and you tell them, ma, could you tell me your qualification? Oh,
no, you don't have to say it that way. Sorry, excuse me.
Could I know your qualification?
What's your name? And if you tell them your name, are you a nurse? Are you a doctor? Stuff like that.
Well, maybe you can only advise them to be very polite about it. But if people if they get offended when you ask them and they give you attitude, still maintain your stance.
Run for your life. I feel like you should run for your life. If someone is getting defensive about their role in the healthcare system, you should run for your life. Because if you see a doctor and a nurse, they'll be like, I'm a registered nurse. I'm
always very proud to say that.
Exactly. So why do you fight someone or take offense
apart from
when
the CHOs or the CHUs or which other ones go to this health tech that they identify themselves? Another thing are the lab technicians, not even scientists, portraying themselves as doctors. That's another discussion.
I feel like the government needs to do better.
Yeah.
There was a time I saw the what's the name for quackery in Nigeria for nurses in the constitution. And it was ridiculous, like the fine or the consequence of being a quack if you are caught is ridiculous. I don't know if it's been amended or recently
Still
or
the
what.
same. Still the
When I checked, that was in 2017 or 18.
Still the
It
same.
was like you pay, was it 1,000 euro or 2,000 euro fine?
Still the same. It's still
For
the same.
performing quackery whereby I could kiss someone and maim them. A lot of people, I think we should have a segment, an episode to talk about this further.
God rest the soul of this public artist who died recently. You would believe me, and then if you are also aware of the verdict that
Yeah.
said the nurse is the only one being prosecuted out of every other ones that have been vindicated. So I don't know if she's a nurse.
They claimed, because NAM looked at this stuff, and NAM is the National Association for Nurses and Midwives.
in Nigeria.
They said she's not a nurse.
Exactly.
That's
See
why
that?
they came out with the verdict that she's not a nurse and they don't know her. And they checked the register from the Nursing and Midwifery Council.
She's not there.
She's not a nurse.
So that's what those things we are talking about. If you allow people to end your life, it's gone.
One spinal loss.
We only have one life to live, and we are never coming back to live. And if you do come back, I don't think we'll live the same life. And then I think most of the prevention of diabetes has been talked about in the signs and symptoms.
Yeah.
When we're talking about people living sedentary lifestyles, do your exercise, eat well, eat in the right ways. We've talked about in the management, and of course, we can prevent diabetes that would happen from gestation, from gestation, and we can prevent pregnancy that can be transferred from. Like family links. We can also prevent diabetes that can be gotten as a result of body owns auto-rejection, the autoimmune types. So
that's why when you come to the hospital, they're always like, your dad, when they take medical history, that's why I would say regular checkup. When they ask, probably the person's dad is deceased, what condition did your dad or your mom have? Your grandparents, what do they have? It's just to trace that if they've got an hereditary disease or condition.
It's one beautiful thing Americans do that I respect a lot.
Yeah.
They do that like their hereditary or genetic links. And no, but preventive care is all about just doing before it happens.
Yeah, and information.
Check. And then when you know that you're at high risk, even if you don't know the past medical history of your past family generations, if you go there to do it yourself, maybe it may sound like we are targeting this to people of a certain socio-economic group. But if it is, a lot of us are being sent to school by our parents just so we can become somebody to initiate them to a better life and to a better practice. So if our parents do not have the chance and the opportunity to do this themselves, this is we challenging the children, the younger population, for them to challenge their parents or to help their parents to be challenged. So I think people should do the test. Routine checkups. If you have parents who are more than 40 or who are in their 40s already, necessary. Once you pass your 30, I think for men, once you pass your 35, you should start doing it.
Nowadays, you see
even as early as possible, because it's affecting children, it's affecting
you should always go for regular checkup.
Honestly, and then another thing our government need to inculcate is maybe admonish people to go for regular checkups.
Yes,
children, middle-aged adults, everyone to go for checkups.
I don't want to go into this, but you see when they do the budget for the Federal Ministry of Health, you see a lot of them allocating money for sensitization of different disease conditions, whereby you end up not seeing them doing this. We will not go into that, but we could only beg and plead with the government.
We can only admonish ourselves.
Yeah.
Even though most of us, we go to school or we study these courses to benefit maybe family members and close relatives. But I think it's gotten to a point where Nigeria, everyone needs to be sensitized.
Yeah, but what will you do if the government fails to do their part when you know your own part? What will you do?
Individually, we can only admonish ourselves and then we strive.
If the healthcare system is terrible, what do you want to do?
Well,
nothing. So we've got to beg the government and play with them to do their own role, whereby they make sure the healthcare system is up to par with the latest innovations. Because most times when we train in the same place.
Yeah.
It's been the instrument. You even see some forceps and dishes.
They're as old as I am or older than I am.
They're older than you.
They're as old as my mom or older than my mom.
You'll be embarrassed.
So,
you'll be like, what is happening here? What is happening? Every year you see them allocate millions of naira, trillions of naira for health, and whereby you see the president of the country, you see ministers, senators flying out of the country. You see them even over here. You see them coming. You see them in the hospital coming for treatment. And you be like, wow, what are you doing here? What are you doing? The current, the past president, the immediate past president, he died in London. Why did he die in London? Why did he not die in Nigeria hospital?
Have you seen a politician who has any belief in any healthcare system?
They need to do better. They need to do better. I think that's.
We're not the first person to say it. The people have been saying it,
We need to
and we'll
keep saying
continue to say it. So, I mean, before we round up the diabetes thing, so there's this myth about diabetes that once it gets to a stage where people start to lose their limb, some people would give up. But because Nigerians, we like to give up too quickly. I was like,
do?
Well, yes, or maybe we don't give up. We just like derive strength from something else. Because I have a case of somebody who lost both limbs, and he said, "Of course, I've lost both legs. What more could I lose?"
Your life.
Before life, my brother. The two ants are still there. I mean, so when you go to bed, I mean, there are people who genuinely lost their limbs due to very, very chronic disease condition.
Yeah.
But for you use your own hand to do yourself. This is one way I can mock you. I mean, sorry to use the word. Sorry to use the word mock. This is blame. I was going to say blame and rebuke. This is.
I mean, it's mainly ignorance. I don't think
it's not ignorance, because this person I'm talking about went to the hospital. He was seen by specialists. Went to like tertiary hospitals, given modifications of diet to follow and lifestyle. This person went back to taking alcohol.
I mean, when we talk about one thing, I think most people
it's stubbornness. I think.
Do you think it's stubbornness? I feel like there's all this condition, there's stigma associated with it, and when the person has it, we don't talk about the mental health part of the wisdom. When you get a diagnosis as a person, when you get the diagnosis, it's when it sinks into your body. Some people try to cope with it using a lot of coping mechanism, probably denial. Maybe it was in denial.
But I mean, I'm still trying. But psychologically, could happen.
Yes.
But then the denial stage. You've denied it.
Yeah.
It's time for you to accept or even be angry about it.
Easy for you to say.
2 limbs have been lost.
Easy for you to say.
2 limbs have been lost.
Yeah, that's what I'm saying.
Being judgmental.
I'm not being judgmental.
I mean, somebody should start to accept. Okay, maybe we should also admonish
It's easy
people
for you to say.
as part of the management
I
that
think
people need to come to a psychological condition point where they accept when this diagnosis is made.
Hospitals is when you give a patient diagnosis and the management and how to take care of themselves. There should be a follow-up. When you notice as a doctor or a nurse that you're looking after a patient, you see a patient and you know that this patient is in denial, you could see it.
Follow-up care in Nigeria is
that's what we are saying. Like as a family member, you see your family member going through a lot of things, and they are saying like what the person said that what else can they lose? Like that.
You
it's not them talking.
Put the fear in them so they can accept the fact that this is crucial and chronic. What more can you lose? Your life, daddy.
Yeah. So
you as the daughter or as the son or as the wife or as the husband, and your wife or your husband or relative is saying, what more can I lose? Your life.
Exactly.
And then the implication of this, we have to talk about it on the family. Even the person suffering from it, and then the society. You are adding number to the report, the data of Nigeria. Your family are going to be. You are going to put them. Everybody will die one day, but then why die from something that
could avoid?
It could be avoided. You are going to put your family in blame game. They would blame themselves why they've not admonished you more to do the right thing, because daddy cannot be challenged or mommy cannot be challenged.
They spend all their
money is wasted. And then one thing with diabetes, oh my goodness, you made me remember my school days as a nursing student. Diabetes injury are so very, very costly to manage. Yes. They are very, 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 very. I use the word very. If I could use very in 20 times, I would. Emotionally and psychologically and mentally draining to manage. Have you smelled a diabetic wound before? I mean, people can have wound up to the point where the muscles and everything and the tissues have been eaten deep. Necrosis, gangrene.
That's why we talk about ignorance. They might just think he's infected. They don't know.
Death is an easy way out, my brother. If somebody died quickly, it's an easy way out. The complications are too much. Because you see wound and then, oh my goodness, there was one wound I saw in UCH back then where there was like a woman, in this case it was a woman who had, I don't know what happened to her, so she had pressure ulcer on the bone with diabetes type 2. Oh my goodness. Whenever we're doing the wound, I was like, the smell.
Were you making that?
The
So
pain.
you are taking care of the patient? Was that the face you were making?
This is not a joking matter. The pain. And she would be crying. The pain.
I can only imagine.
Apart from that, like, you have to be on these antibiotics, like,
Yeah.
and at some point she became resistant to everything.
Exactly. That's another issue.
See, that, to me, that is an easy way out. If anybody falls into those category of having the wound or that ketoacidosis where the wound is not just healing, they have to be in the hospital, no treatment is working, no medication. So many family members will run away. I feel too emotional to talk about this. So many family members will run away from you because I'm coming to see my mom and I see the wound, and there's the bone. Your bone is being seen live and direct under the wound like this. And you know, when you've had meat for more, we kept your meat in the fridge and never took light for days. You know, when the meat spoils, it's like touching it and everything is like removing, like bread. Not even the normal agege bread, normal correct bread. The bread we don't still, you're removing it and it's just removing like paper soaked in water. Exactly. So
yeah, that's
funny now, but then that is exactly the picture I have in my mind. And it was why I decided that you would never see me in the diabetic unit ever. Because even as a nurse, the implication of me is high.
Yeah, on everybody. I think the impact is felt.
I can't just stand it.
I feel like we've come to the end of the podcast. I think this has been really informative, and I believe everybody has always known. If anybody wants to take anything up from today of what we said, we've talked about type 1, we've talked about type 2, and also the lesser known one, which I think some people might be hearing for the first time. Diabetes insipidus.
And of course the gestational.
Yeah, definitely gestational, and the complications from diabetes, the diabetic ketoacidosis. You explained to us very well, vividly. And also the main aim of this program, we have serious talk and we laugh about some issues, but it's mainly to educate ourselves and our family members, our friends and our neighbors to be able to have power over their health, to give them, because information is power, and this is to empower them about their health, to go about and tell everybody to get tested. You should get tested like every 6 months. If you're unable to get tested every 6 months, why not do it every year, just to be on the safer part? And don't forget, don't ignore any symptoms. Something that is out of the ordinary. Maybe you started having nice sweats, a lot, like when you wake up, it's like
sweaty.
Your clothes is like you jumped inside water and your clothes is like drenched, or you are waking up in the middle of the night to urinate. Maybe before you wake up once to urinate because
it's progressing to three, four times.
And it's not just one day, it's every day. You should like go to the hospital. Don't ignore symptoms. And remember, when managing diabetes, it's possible to manage diabetes. Like you said, it's not a death sentence.
Absolutely.
And you should not be thinking that, I'm going to lose my limbs because they've got diabetes.
I've looked at some people who have had diabetes for 20, 30 years and they've not lost any limbs and they are living normal life.
Yeah, so with knowledge, support and care, you as a person, don't just think, this person is gutty. Everybody needs whatever support. If they've been diagnosed with something, they need your support to help them get through it, because it's not easy. I'm not going to lie to you, it's not easy having to use drugs. Someone that's had a condition a while back, but thank God it's gone now. Using drug every day, being alone. In fact, they might even like tell you that you have to be off work for a certain amount of time just to like be hospitalized or be at home resting.
Be properly taken care of.
Yes, be resting. So it affects you when everybody's gone to work.
We pray that people who need chance to stay away from their work would find support from family, from loved ones, and then even from their bosses at work. May they show them mercy, because that's another thing.
Yeah,
there's always this debate around if I need to get away from work, would my boss allow me leave? Do I have the grace to leave work for some time for me to look after my health? I think may not get to a point where we have to decide between work and life. But if it ever gets to that point, I think I would choose life.
Thank you very much. If you've learned something from today's podcast,
Remember to share
Like-
to your loved ones.
like, share, and subscribe so that you get more informative discussion. And also, let's make health a conversation every day. You should have a conversation with people every day about healthcare. Remember, stay informed, stay empowered, and your health is your future. See you next week.
Thank you. Bye-bye.